My name's Henry Tuttle. I'm the Chief Executive Officer here for Outer Cape Health Services. We operate two federally qualified health centers, one in the town of Provincetown, the other in the town of Wellfleet in Massachusetts. We also have a business office in Eastham, and we have an outreach office in New Orleans where we provide WIC services for women, infants, and children. And that program runs from our service territory, which includes the 8 outermost towns on Cape Cod from Harwich to Provincetown. We care for between 11 and 12,000 patients a year for around 38,000 patient visits a year.
The programs that we're partnering with CAVU on are for a pediatric overweight and obesity intervention, and it's really a multidisciplinary program that will involve myself with a full medical evaluation, as well as a nutritionist and a behaviorist. And it's really important here for our population, as it is everywhere. Again, while we're very different in some of our unique sort of population and struggles, we're similar to other community health centers in that we recognize that pediatric overweight and obesity is a growing, literally, problem. In our area, there was a study done last year that showed that 47% of elementary school children in one community were overweight or obese. And that's a huge number. That means 1 out of 2 children are going on to develop diabetes at a much earlier age. Type 2 diabetes, which is usually related to overweight, used to start around age 50, and now that average age is down to age 30, and that's because kids increasingly are overweight and obese, and so they're starting to see the burden of diseases that we didn't used to see until, you know, that generation come upon us much earlier. In addition, we know that these kids are at risk for high blood pressure, high cholesterol, pre-diabetes, as we talked about, or type 2 diabetes, and heart disease. So, you know, this is really an urgent problem, and this is something that we need to address quickly. And CAVU has partnered with us to allow us to do a lot of intervention that we couldn't do otherwise, partly because insurers don't pay for problems until they come up. So to tell them to pay for the potential of something in a pediatric population has not yet come to pass.
We have contracts with the town of Provincetown and with the town of Truro to be the on-site pediatrician through our pediatrician, Dr. Jolie Edwards. So we've begun to make inroads in bringing care to patients rather than waiting for them to come to us.
Additionally, there are resources available, but they're far away. The nearest program for pediatric overweight and obesity is in Boston, and most parents are unwilling to do a 5-hour round trip, take a day off from work, and wait a year to even get into the programs. And even then, a lot of them can only get in if they already have an identified disease process related to being overweight and obese. So being able to partner with CAVU really is a unique opportunity to step in before these established problems have arisen, and in a timely fashion, and for a population for whom access is really an issue.
My name is Frederica Williams, and I'm the President and CEO of the Whittier Street Health Center in Roxbury. We have been a health center for 75 years. We were founded in 1932 as a health unit in Roxbury. We serve 12,000 people from 20 different countries and have 17 languages spoken here. We provide about 40,000 clinic visits at the health center, and in addition, we provide another 20,000 visits outside of the health center in health education and promotion, because our focus is around wellness and prevention.
I think there are a lot of things that are unique about Whittier Street in general, just in terms of the level of care we provide. I think that, you know, I sit in a lot of administrative meetings, and I'm always amazed at how the type of patient we serve really has no impact on the type of care we strive to deliver.
We provide a wide range of services, about 30 different health and social services. Our mission is to provide reliable, accessible, high-quality primary health care and support services to eliminate health and social disparities.
In pediatrics, we've also gone a bit beyond the usual standard of care in pediatrics. We have in-house specialized clinics for obesity, the Healthy Weight Clinic, asthma, as well as high-risk adolescents. I think that really affords our ability to deliver cutting-edge care. So we have one provider champion for each of those clinics who establishes an expertise in that field, a clinical expertise, and then the other providers within the practice refer to that provider. So, for example, I run the Healthy Weight Clinic, and so if either of my partners detects a patient who's overweight, they'll do the lab screening. They have a checklist of what the labs are that they're supposed to do, and then they'll send the patient to me for further management. And then I work in conjunction with our nutritionist and our case manager to find the right diet and exercise options for the patient to really have an impact on the way that they have their lifestyle. We're partnering with the CAVU Foundation to deliver Race Around Roxbury, which is an after-school program that targets increasing physical activity in children. It's been a great partnership in that they've been really supportive of our ideas. They really support innovation. And over time, we're looking to roll out the Healthy Weight Clinic model to other health centers in Boston and beyond. And I think that partnership will continue to grow.